caster.
Okay.
Yeah, we are live now.
Now it has come. Now it has come. Give me a few seconds and then we'll go live.
Okay, no problem.
So we will be live in 5, 4, 3, 2, 1.
Warm welcome to the Indian Orthopedic Association unique program on the prevention and healing of burnout for the healthcare professional. This is the first session of 2 sessions program. At the outset, I should like to thank the India. Indias is basically an Indian network of the diaspora for essential aid and relief. It's a non-profit organization, non-government organization of the mental health professionals across the world. They are working to support the healthcare workers across the country, across the globe, so that they can function with a maximum wellness, with a very good mindset. So that's the aim. And actually, because of the support, because of the help of India, we are able to do this program. So at the outset, I should like to thank India. The first question is, why this webinar? A lot of people, they have some doubt that burnout is not seen. It's not the actual thing. It's not the reality. It's just a hypothetical situation. So let me give some statistics. Basically, before that, let me tell the Indian Orthopedic Association is basically doing activities of sharing the knowledge, training the people, conducting the research, forming the guidelines, and making the patients and their family members aware about various orthopedic conditions. Basically, the aim of doing all this is to prevent the disease primarily, to improve the results of treatment, that may be surgery, that may be a non-operative treatment, to improve the safety of the patient during this treatment, and to make this treatment less expensive. Basically, we call this a patient-centric treatment, which is absolutely a very valid aim. However, the problem is during that, we forget our own wellness. Doing good for the patient, we forget about ourselves, and that's where the problem is. And that results into a lot of problem, not only to the physician, but also to the people surrounding the doctor. The recent statistics carried out at the American Academy meeting says that 38% of orthopods, they suffer from burnout. This is no doubt USA data. We don't have our Indian data, but I'm sure that if Indian Orthopedic Association carry out a similar survey, we will be able to identify almost the same number of people suffering from burnout. This results into a poor mental health of a person who is providing the treatment to the people, and that results into a poor decision making. That results into more complications during the treatment. That results into a poor outcome. Again, that leads to dissatisfaction to the patient and to the physician himself or herself. And ultimately, sometimes that results into malpractice suit. The worst thing is doctors amongst all professionals have the highest incidence of suicide. Though we are very well educated, still it's really sad fact that doctors have highest suicide rate. So this webinar is a small step in improving this situation. And I'm sure that this is going to have a huge impact for all of us. So I know that this is beginning, and Indian Orthopedic Association has taken a lead. And I'm thankful to Dr. Siva Shankar, the president of Indian Orthopedic Association, and Dr. Naveen for accepting my request to carry out this webinar. We are really fortunate that we have 2 expert faculty from USA. The first is NC Lewis and second is Geetika Talwar. Let me introduce them. NC is licensed clinical social worker. She is assistant director at Fordham University. She is the co-founder of Velocity Vision Incorporation, basically that offers personal and professional training to the people for their development. And her main interest is prevent burnout and compassion fatigue. And we are really fortunate that she is the right faculty for today's webinar. The another faculty, Dr. Gitikal Talwar, she is a young psychologist in Seattle, Washington. She did her PhD from University of Maryland and master's in social psychology from Mumbai. So she knows the Indian context, and her again area of interest is to help the healthcare professionals to fight against burnout. So our faculty is from USA, but we have experienced panelists from India, and they are also going to share their views about the burnout, what they see, what they feel, and what they experience in the practice. So we are fortunate to have Ajit Kumar. He is from Tejaswini Orthopedic Institute from Bangalore, very famous trauma surgeon. We have Dr. P.N. Gupta, who is professor of orthopedics at Government Medical College, Chandigarh. We have young Vaibhav Bagaria, who is director at Sir H.N. Reliance Hospital in Mumbai, a state-of-the-art hospital. And we have another young arthroscopist and trauma surgeon, Prahlad Singhi, from Preeti Hospital, Madurai. So they are going to give us the real situation about burnout. Just a brief idea about what we are going to discuss in this session. We are going to first of all understand what is burnout. We will discuss the symptoms of burnout, and the most important is how to make a diagnosis. This is not going to be a only lecture, but we are going to have some interaction which will also help us to understand how this knowledge is applicable in day-to-day life. The second session is on next Friday, that is 19th November. And in that, we are going to discuss the causes of burnout, what is a neurobiology of the stress and the burnout, and the most important and important for all of us, how to prevent it and how to treat it. If you have any question, please send your questions, query, comments, feedback to this number 97129 25600, either by text message or by WhatsApp. So with this, I hand over now to NC to carry out the further proceedings. Over to you. Thank you.
Thank you, Dr. Direen. So I'm going to ask my co-facilitator to pull up the slides. I want to thank everyone for having us here today, and also for being open to this topic, because as we go through the material, I will show that one of the reasons why burnout persists is because healthcare professionals, especially doctors, do not feel, or there is a stigma against getting support in emotional wellness. So that actually contributes to burnout continuing. So the fact that this presentation is even happening is a great step forward. So we had a beautiful introduction, but I just want to add to that a little bit that I have been teaching and facilitating continuing education on burnout, compassion fatigue, and secondary traumatic stress for healthcare professionals, especially those that are in the mental health field. I am a social worker by profession, 20 plus years in the field working with families, adults, and those in the foster care system here in the United States. And I'm also an assistant director in higher education for those who are earning their degree in social work. So I've experienced as a healthcare professional in the mental health realm that burnout is very real and that we all have to take steps to prevent it. And I want to just hand it over to my co-facilitator quickly before we move on to introduce herself.
Yeah, hello everyone. My name is Gitika, and thanks so much for this wonderful opportunity to speak to everyone about burnout. I earned my PhD in 2014, and after that, having worked in the field before earning my PhD and after, I think noticing the tremendous work we can do as we serve our patients. And I've had patients from all over the world living in the US. And I think the passion that I've really developed for preventing burnout and healing from burnout comes from the realization that all of us are such important resources for the people we serve, and taking care of ourselves is a very important way we take care of others. Because if we as a resource dry up, where will the people we serve go? So my passion for helping my colleagues in across the world in various domains of healthcare, preventing all of us from burning out, continues to be just one way that I hope to serve the world. So thanks so much for this great opportunity to speak to everyone. All right, are we ready to go, Nancy?
Yes, please, let's move forward.
Okay.
So we
Is everyone able to see the screen okay? Sorry, I just wanted to, yeah, perfect. Okay.
Great. So we'll be going over the definition of burnout, signs and symptoms, and measuring burnout. Some of you may have received that ProQual tool. We'll go over how you can use that as a baseline to see where you are in the realm of three big areas, which is burnout, compassion satisfaction, compassion fatigue, and secondary traumatic stress. And we'll break that down. And we'll talk about ways, even today, we want folks to walk away with something right away that they can apply to prevent burnout. So next slide, please. So we would like to ask everyone to have community agreements to participate in that way, to create a space that's non-judgmental. When we talk about emotional health, sometimes there are preconceived notions that may get in the way. So we ask to be open to new ideas. Some of the things that you hear today might not be of the usual type of information that you have. It could sometimes not be something that you have knowledge on or feel that belongs in a medical science, but there is medical science that is connected to burnout. But it's important to be open to new ideas and just gather that information and then decide whether it's something you want to incorporate. Being present is very important because we all have very busy lives outside of these workshops, and our to-do list might be running through our head. But so we ask in this next 80 minutes or so to just be present with us so that you could get the most out of the workshop. And then another big thing, and I've taught this at Columbia University, compassion fatigue and burnout topic, for a full day workshop, 9 a.m. to 5 p.m. So things come up. Because we are touching on the realm of emotion, sometimes things may come up for us. It is okay if that happens. We've had folks, professionals, cry in our workshops, and they've had to excuse themselves momentarily, but that was a form of healing. And so awareness sometimes brings emotion with it. So if that happens, that's okay for you to blank out your screen for a little bit, take a break, and come back. And we'd like you to be yourself today and free of judgment of self and judgment of others. You can go to the next slide, please. So the definition. So it is something that was recognized by the World Health Organization officially. Burnout is an occupational phenomenon, and it's conceptualized under three areas. It results from chronic workplace stress that has not, this is the piece, that has not been successfully managed. And that is the important piece. We will all experience workplace stress, but the management of that and how we manage it and how we look at it is what determines whether we are at risk to burn out or to be resilient. So here are some three areas that come under burnout. Feelings of energy depletion or exhaustion. This is beyond just a regular workday, coming home and saying, I'm tired, I need a good night's sleep, and I'm better the next morning. This is complete and total exhaustion and depletion, and something that lasts more chronic. Increased mental distance from one's job or feelings of negativity and cynicism related to the job. When I've worked with professionals in my full day workshops, some have shared that they came in very excited in the field. The first 2 years, they were very happy with the work, very happy working with clients. And then it came to a point where they didn't want to go to work. They were avoiding work, calling in sick, or avoiding client and staff phone calls and emails. That's one sign of it starting to seep into your feelings about your work. And then a big one is the reduced professional efficacy. This, simply put, is that you feel a lack of purpose, effectiveness in your work, almost like, what is the point of all this? So these are the 3 areas that the World Health Organization recognized that contribute to burnout. And they made it an official occupational phenomenon in 2019. You can go to the next slide, please. So there are different areas that come under the signs and symptoms of burnout. Physical areas, feeling tired, and it can affect your immunity. You may be exposed to more frequent illnesses, headaches, muscle pain. This is not just once in a while that you may experience these things, because we all are under the weather or may experience physical symptoms in our work, but this is more of a chronic nature. And then change in appetite or sleep habits. Under the emotional realm, that feeling or sense of failure on a regular basis. Sometimes we may have a tough case, or we may go through a period or a phase at work where we feel like, I didn't handle that so well, or that particular situation at work did not go well. But this is more of a sense of failure all around, a chronic sense of failure. You feel trapped, helpless, defeated, and it's not just a momentary phase. Then the feeling of detachment, you feel alone. You don't feel like that there's any purpose to you and your work, and you feel like you're the only one going through this. A loss of motivation. Your interest in your work has depleted to the point that you don't even want to work anymore. Increasingly cynical about the work and the negative outlook. Possibly that also spreads to life, not just the work. Sometimes when people are very burnt out, they tend to see life through a lens of negativity. Decreased satisfaction and sense of accomplishment. That also could be all around, not just at the workplace. And then behavioral things that can happen is withdrawing from your responsibilities, possibly not even fulfilling responsibilities in the home environment when your workplace stress and burnout becomes so high, isolating yourself. I've had folks in my workshop say they stopped going to the functions with their family. They just felt so depleted and tired that even though they had the day off, they didn't feel like joining anything. Procrastinating, taking longer to get things done, using substances or food to cope. That could be alcohol, that could be substances, that could be increased use of unhealthy foods like lots of sugar or caffeine, but on a chronic basis. And then taking your frustration out on others, maybe yelling at your children more than you need to, yelling at your spouse or your partner, and then skipping work or being late or calling in sick when you're feeling okay, just to avoid. So I think I see a quick question in the chat room about expectations of the profession. We will be talking about that. And yes, that is a contributing factor, is the way that you see things, the way that you expect of yourself and the environment does play into chronic burnout. If you are not able to adjust some of the views and perspectives, that could be more healthy in your ability to respond to workplace stress. Next slide, please. Are you able to? Okay. So one of the things that we really want to touch upon, and it seems like it's a slight diversion from the burnout, but it's so important, is compassion satisfaction. The reason why we're emphasizing this is that compassion satisfaction is a big protective factor against burnout. And that is the pleasure that you derive from doing your work. I really love being a doctor, or I really love being a social worker. I love the care that I provide. I love the intervention that I provided that helped support this individual or this family. That is compassion satisfaction. I like going to work because I like what I have done to contribute to the community, to contribute to the folks that need my support. That sense of achievement, that sustained motivation, and that inspiration and enjoyment, emotional, that feeling of demanding work, but I enjoy and derive pleasure from doing this demanding work. I emotionally feel good about it. That is a protective factor. So one of the things that can help is building compassion satisfaction in the work. Some folks have low levels of it, but that can be built up. And some folks are naturally high in it, and that can be sustained. So please advance to the next slide. So the compassion fatigue is one of the cousins of burnout. It is the lack of being able to be empathetic or compassionate and feeling negative about the help of others. So it can also be, it's very close and sometimes can be confused with burnout, but it comes from the feeling of lower empathy and support of others, either coworkers or loved ones, and that satisfaction that you get from helping others is no longer there. So it is a sense of more of a emotional exhaustion and the loss of empathy and the loss of wanting to support others. So that is also a very strong factor in affecting workplace stress, is when you hit compassion fatigue, where helping others becomes more of a burden than a joy. Next slide, please. So I believe at this point, Geetika is going to talk to us a little bit about the vicarious trauma.
Yeah, so vicarious trauma or secondary trauma is when you personally may not experience any danger to your body or yourself, but watching others go through pain every day, watching your patients again and again go through some kind of pain, you end up experiencing some physical, psychological, and emotional, spiritual damage to your own self, because you're seeing this suffering day after day. And most importantly, you're having to control your reaction. If you experience shock, but you can't show it to the patient because you have to stay calm. So we keep trying to stay calm and manage our human reactions while the patients are going through all their suffering. So our brain actually does not necessarily distinguish between imagination and reality. It also does not distinguish between your pain and another person's pain. If you feel something, the brain continues to treat it like, oh, you're going through something as well. So when you are controlling your reaction, the brain is not getting to go through the entire experience of stress and release, stress and release. Your patients might be able to experience that thanks to you, but you may not be taking care of your own self. And after the patient has still gone, so sometimes when we encounter very shocking cases, or you end up seeing something that feels a little out of the norm, or even if you're seeing the same thing over and over again, when you find yourself thinking about it outside work, the brain is treating it like that whole stress reaction is happening again. So you end up encountering symptoms of trauma, though you yourself may not have gone through it. And in the work that I have done over the years, I have definitely noticed how persistent compassion fatigue, persistent secondary trauma does lead to some symptoms of anxiety and depression if it is not treated. So this is definitely one aspect of burnout to also consider. And sorry, the next slide. So today we're actually going to talk a little bit about the ProQual scale, which I know we'd sent out earlier as well, and hopefully folks have had a chance to fill it out. But the professional quality of life scale was essentially created to help measure compassion satisfaction, compassion fatigue, and secondary stress. It's a 30 statement, so a 30 item measure. It's self-report. So it's, if you feel this is true, then you write on it. So it's self-report. It's relying on your own assessment of yourself. It measures, of course, compassion satisfaction and compassion fatigue. And compassion fatigue itself has two subscales, burnout and secondary trauma. And most importantly, ProQual is globally one of the most widely used measures of the positive and negative aspects of helping. Across the world, it's been also translated into multiple languages. It's been used for the past 15 years, and a lot of research around burnout in healthcare professions, every kind of healthcare professional, a lot of that research uses the ProQoL measure to actually measure burnout among people. And it is considered a valid measure. So valid is a very key word because it ends up implying that researchers have actually looked at what are the concepts of compassion, satisfaction, and fatigue, and do the items on the ProQoL actually define those concepts properly, and are they measuring it properly? With the multiple rounds of research they've done on the ProQoL, they are able to say with great confidence that it is valid as a measure of compassion, satisfaction, and fatigue. It truly measures it well. And the measure itself was developed with data from over 3,000 people. People were interviewed right and left, made sure that they're understanding everything that they need to. So it's a very good measure. So, Dr. Dhiren, when earlier you were mentioning that there isn't data about burnout in healthcare professionals in India, this will be a great place to go if you could just chavi a few researchers to do it. And then over to you, Ansi.
So this is a visual representation of what was just talked about. The ProQoL measures professional quality of life, and the scales are compassion, satisfaction, and that's it given its own scale because, as I mentioned before, it is a strong protective factor. We will share and ask, the article to be distributed, that there was a study done in Spain where there was a high rate of COVID, and as folks saw on the news, they were greatly affected. And they found that compassion, satisfaction, and self-compassion were strong factors in protecting the doctors that had to work in the front line when it was during COVID. So it's that powerful. And I will share that article to be distributed later. But that's why it's measured in a separate subscale. And then under the compassion fatigue scale, there is burnout and secondary traumatic stress. So the ProQoL breaks it down this way. It is very helpful to see what your baseline is. I've taken the ProQoL more than once, and I look at my numbers to see where I am. I was surprised to find some things, and I'll share that in a bit, but it's helpful to know where you are in these different subscales and know that it's not permanent. So if you're at the brink of compassion fatigue or burnout, there's always a way to improve your emotional state so that you can have higher levels of compassion satisfaction. So that's the good news in this, is that this will give you an opportunity to see where you are and where there could be some work done to improve things for you. Because as we shared earlier, and as was shared in the beginning of this presentation, you will be able to help others the best when you yourself are doing well. Next slide, please. So these are the scales, and for the purposes of just being aware of where you are, and also to look at what is important to pay attention to and work on, I would have your focus be on the sum of your compassion status in this subscale, compassion satisfaction, the sum of your scores. So the middle column where it says, so my score equals, you don't really need to pay attention to that for now. It's more of where is your score? And then that third column, what does that level indicate? Are you low, average, or high? Because that will then help you know where to make modifications or improve. So for example, I will personally share that I wrote down my scores. I took it again recently just for this workshop, and my compassion satisfaction score was a 45. And that is 42 or more, and that's considered high, a high level of compassion satisfaction. And I'm going to be quite honest that I don't work in easy conditions. I have a high stress position. I'm also a mother of two, and I have a child with medical special needs. So it's not that things are easy, but I have a high level of compassion satisfaction because for years, I've been doing the work of prevention. And that is how my score became that high. It wasn't overnight, it wasn't automatic. And so I'm able to preserve that level of compassion satisfaction through the work that I do for my emotional wellness and my physical wellness. And it's a protective factor for me under these high stress conditions. So the next slide, so we could talk about the other scales. And then the areas that need to have special attention is the burnout scale and the secondary traumatic stress scale. The burnout scale needs a little bit more work in terms of scoring because you have to put in the number that you rated and then do reverse scoring. So if you're rating on those with the asterisk, for example, if it's a 2, you would turn that to a 4, and then you would add it up with the reversed score. So this takes a little bit more work. In my rating, my personal rating, I had a burnout of 25. So I'm not in low, I'm right there in the average. And for me, that means I should just pay attention. Now, I'm not high, but I always look at that to see that I could be tipped over to the other end. And so I need to be careful. What am I doing with my daily life in order to preserve a healthy place on that scale, to not tip over into burnout? So I'm right in the average range. And then when I look at secondary traumatic stress scale, I'm at a 13. So that's a pretty healthy place to be right now. Whatever the type of work that I'm doing professionally is not causing me secondary traumatic stress. I'm in the low range for that. So in that, I use myself as an example, and my score may change next year when I take this again. When I first took it, I was actually surprised to find that my compassion satisfaction score was as high as it was. At the time I first took it, which was 4 years ago, I was experiencing high levels of stress from a leadership that was not going quite well at the position I was holding, and it was causing me tremendous levels of stress. So I thought I would be high on burnout. But because I really enjoyed the work and I knew how to engage with the clients that I was working with in a way that didn't cause or contribute to my own emotional issues, I was able to use my compassion satisfaction to even out my burnout and to not fall into the burnout pit and have more work to do to get out. I was able to use my compassion satisfaction in a way to support my well-being. And then over time, as I learned more skills and mindfulness techniques, which we'll also be talking about, I was able to raise my compassion satisfaction score even higher. So next slide, please. So we wanted to take this moment to stop for any questions and talk about the ProQual and see if anyone who took the ProQual feels comfortable sharing any part of their results or if anything surprised them. And we wanted to take a few moments now because we did give you a lot of information, and this is a good point to digest some of that information and discuss it.
Yes, any of the faculty would like to share about their score? I know that no one would really like to be open to the audience. So, NC or Gitika, like how do the people, when you do a workshop?
Yes.
And when someone who's not performing well on the burnout scale, do they like to tell their colleagues or the co-participants to or make them aware about their situation?
So that's a good question. I've done this workshop 4 years in a row, every year, for Columbia University, and it's for healthcare professionals in the mental health field. And each year we get sold out because there is that need to stop holding it in and to discuss it and find some healing. We've had it come out in different ways. Either they share it through a pair share where it's a one-on-one with another partner, and that, or they talk to us after the workshop to talk about how to get support outside of the workshop, or they share it out loud if they feel ready. Sometimes we have the participants share in a way that doesn't reveal their score, but they do reveal what surprised them. So they might say something like, I'm surprised that my burnout score is higher than I thought it would be. They won't necessarily say I'm on a very high level of burnout, but they might say it's higher than I would like. And this was an eye opener for me. I need to now pay attention, because the key here is not to judge. That's why we have that opening statement about agreements. It's not to judge or deflect or become or to say that this is something we should ignore. It's to bring awareness, because once we have awareness, we could choose what we want to do with that. The awareness could say, I need to make some lifestyle changes, or the awareness could say, I'm not doing well, but I'm going to just continue this way because I don't think that I need to make any changes. Awareness is what I think is a great gift, because then you have the choice to do something with it.
Yeah, let's start with Ajit. Dr. Ajit, like,
Yeah.
what do you feel about your
Yeah.
score?
I mean, as regards the compassion satisfaction scoring, it was pretty high. Quite happy with what I'm doing, and quite happy with the response, that the feedback that you get. So from that point of view, I think the satisfaction score was pretty good. But the fatigue score, I'm not sure. I mean, sometimes we just think that it is age related, or the physical exhaustion that you feel you're getting on in years, and probably it's that. I don't know whether I could really differentiate between my going ahead in years or going down the other way in terms of burnout. So
Okay, to like to get your answer, like whether the age is really an important factor or not, because usually we feel that as the age advances, we are more likely to have burnout. So let's ask Dr. P.N. Gupta, what do you think? Because he is probably the senior most or the second senior most in the faculty. So Dr. Gupta ji, what do you think about that?
Yeah, it actually depends, and my feeling is it depends on a lot of factors. Your own perception about what a burnout is, your surroundings, your financial status, and a lot of things. So as far as the professional satisfaction goes, it's good for me. I agree with Dr. Ajit that as far as the fatigue goes, sometimes, there is a lot of confusion in my mind whether I'm fit enough or I'm not fit enough. So again, I mean, but while doing the questionnaire, I find that, some of the questions, I had some doubts in my mind. Like, sometimes you feel I would be scoring like good, or sometimes you feel this is fair. So some of the things I had some doubts. I mean, not because of the scoring system, but my own perceptions about some of the things. So I don't know what others feel.
If I could just add to that, Dr. Gupta, what you're saying, and also the question that I think Dr. Dhiren put in the chat
Yeah,
as
that box.
well. The challenge with self-report is exactly that. That sometimes there will be like, I don't know, I think it's fair, or I think it's good. The thing is, it does change. It does change every few weeks. So doing it every 3 months or so is helpful, because when there is no confusion, oh, no questions about it. This is great, or this is awful, or this is bad. So when there is doubt, those are the scores that those are the statements that are telling you something about, there is something going on here. I need to do something about it.
So, Dr. Geetika, let me ask you one question here. So, do you feel that some of your people whom you counsel, they feel that okay, my score is poor, and their level of satisfaction suddenly goes down? Oh, my score was supposed to be good, but it is reflecting poor in this questionnaire. So, how do they feel about this?
So one important thing that I do, and the Ansi and I are we very talk about this quite a bit, is that we're very careful about making sure that these scores are not used to judge yourself. There's something wrong with me. It's like a thermometer gauge, right? I mean, it tells you, oh yeah, there is fever, there is something going on. What do we need to figure out here? So I usually tell people, if you thought that you were doing really well, but the scores are saying this, what feedback are you missing? Are you ignoring some information and saying, no, it's fine, I'm just not going to think about it? So this let this tool, the Proqual, be your friend, that who's telling you, you keep saying everything is okay, but I'm seeing what's happening. So it's not to say it's good or bad. It is a thermometer gauge that is telling you, hey, look at this.
Okay, good.
Yeah, Vaibhav, what is your feedback on the Procol?
For me, I like this tool because it, again, offers awareness, no judgment, just awareness. And it measures the areas for professional satisfaction and professional risk to emotional health that you can use as a starting point to see where you are. There was a question about, do we take it every year? You don't have to. It's something that you can invite as a tool if you wanted to help your organization or your department start to really provide prevention of burnout, because doctors are at high risk given the nature of their work. But the positive news is that there's a way to prevent it. And the Proqual could be an assistant in that, to just say, am I okay? Am I on the right track? Is there something I need to pay attention to? So if you use it as a friend and not your foe, I think it can be valuable.
Okay, so that's, I think really the thermometer part was really a good analogy about this scoring, that it tells you that something is wrong and something needs to be done. It does not tell you the diagnosis, but at least it gives you the suggestion that yes, there is something wrong. And many a times, like, we feel that my body temperature is normal, but when you measure, actually you had a fever. Or sometimes you feel feverish, but if you measure, it may be normal. So the same thing can happen with this score also. So Vaibhav, what was your feedback like when you undergo this scale or this scoring? What was the outcome?
So I had a fairly good outcome, so I'm happy and smiling. No, but it is kind of reinforcement that what path you are taking is right one. And as everyone said, it's a very dynamic situation. Some days you may feel that you are bogged down. It may change months to months, maybe day to day also. But there is some objectivity to it. So if you feel, for example, if you feel feverish, you should take the thermometer. Maybe it will say that you are normal, and be reassured that you are okay. But of course, there is an objectivity to it, and then if it is showing a fever, then you need to take a medicine or take some preventive measure. So I'm sure we'll learn about the medicines and preventive measures, but an objectivity to this situation always helps. So whenever you feel feverish, you take the temperature.
Okay. And Prahlad, Dr. Prahlad, what do you think about this? And what was your score? In which grade? High, low, average?
Yeah. I'm good, fair enough. So my burnout level is like we are getting more mature, and we have started taking out time and spending time with the families. We are taking out time to do some physical activities, and maybe we are growing up more mature, like we need to spend time more so that with the family, with the physical activity, and so that we can definitely put more efforts on our profession. So my one doubt was like there was a thing that how often we take up this scoring. So like Geetika was telling, like once in 3 months or some this thing. So and the one more thing was like institutes. So the institute should hire or take up this scoring system, and so that they can avoid the yeah.
Yeah, Geetika, would you like to answer that question about the institute taking this? Because it can be a double-edged sword. Like, say, if you or if your institute realize that this...
Very true, very true. So
Actually, Ansi has had a lot more experience with the ProQual, and I know we are also going to, in fact, be covering the responsibility that institutions have. Now that we know that this measure exists, it's used across the world, and 3 months is like just, it's an arbitrary number. It could be every month, it could be once a year. But I wonder if Ansi may want to actually speak about institutions and what they could do around this measure as well.
So from my understanding, my work with the protocol, my reading about it and how it's used, it's more of a personal tool. And it's for you to gauge where you are and to bring awareness to the areas that you would like to work on to improve your well-being. So if you wanted to bring it into a bigger context and starting groups, peer support groups, it should be brought in, I think, more for the awareness of the individual to make changes, and then possibly a discussion of how those changes can be made on a systematic level. But ProQual was really meant to be used as an individual measure and a personal measure. So that's where it started. How to spread it into bigger things, I think it's worth a discussion with like-minded individuals of how they could bring systemic change, but it really was meant to be a personal tool.
So the question is like, can it be used as a lot of hospitals, they suggest or recommend that every year the doctor should undergo a physical checkup, like the measurement of diabetes, the measurement of blood pressure, the stress test or something like that. This in the same category, can it be used that like how good your mental capacity is or how good you are doing mentally, is it worth measuring?
It's worth measuring, I feel, if there is a high level of turnover or people calling in sick, leaving the job, quitting, things like that. I think it can be helpful to bring this tool to the employees, but again, to be a friend, not a foe, that if somebody, they shouldn't be forced to share their scores. It should be more of making sure that they're working on those skills of self-care and prevention, but the score is a place for them to look at how much work and which areas to focus on the most.
Regarding the symptoms, like I have a query. Like in one of the webinar, I heard that a lot of doctors, they start doing a lot of exercise, like running a marathon or going for like 100-kilometer cycling. So that expert says that this could be one of the symptom of burnout, because you are not happy with your profession. You try to divert your mind in the physical activity. So is it right? Like, because I have seen a lot of my colleagues, colleagues, they are also indulging into a very heavy sports activity. So what do you think about that symptom?
I
can-
wonder if, oh,
Go
sorry.
ahead.
Go ahead, Nancy.
I was going to quickly say that in mental health, we look at the impact of anything that you're doing. So for example, in OCD, if you wash your hands a few times more per day under the context of COVID, that's not considered interfering or a negative impact. But if you are washing your hands 30 times a day, it has an impact on your health and your lifestyle. So to me, any of these activities you partake in, we look in under the mental health umbrella as how is it impacting you, your lifestyle, interfering with your functioning, and is it causing a negative impact over a positive one? So that's the gauge of what I feel it needs to be looked at. So I hand it over to Dr. Gitika to expand on that or offer other.
I was in fact thinking that it would be a good time to go into what we were even discussing about healing from burnout strategies, because anything you do to take care of your body will come up. And sometimes I think the things that we are doing to take care of ourselves in response to any challenge, whether it's burnout, whether it's stress at work, I think it's very important to see those coping strategies as at the heart of it a good thing. And anything that's done in excess, and like Ansi, you were saying, anything that impairs with your functioning, your ability to do the things that you need to do, if it's impacting that, then any coping strategy can be risky. But I think taking into consideration whatever people are doing to heal from a challenge needs to be seen as at the heart of it a healthy attempt, because you're trying to go back to health. You don't want to feel burnt out. You're trying to run a marathon. That's a great thing. And maybe we need to consider, like, does this person have no option but to run a marathon to recover from burnout? That says more about the situation creating the burnout than it says about this poor guy who's running a marathon. So I wonder if it's a good time to switch to
Yes.
healing from burnout. So I'll just share a slide there.
So one of the keys to preventing burnout is self-care. So self-care is often misunderstood. You can also put in the chat room, if you'll feel comfortable, what you think of when you hear self-care. Because a lot of times, and when I've done this workshop for professionals in the full day workshop, a lot of folks have a misconception of self-care. And so I start by the definition, which is activities or practices we engage in on a regular basis, not just once in a while, to reduce stress and maintain or improve health and well-being. And under the research and all the things that they looked at, self-care is one of the main components of preventing burnout. So I'm just curious if anyone has a different idea you could put in the chat room of what self-care is, because I've often heard many interpretations of self-care that can be connected to myths about self-care. And one of the big ones I get is that self-care is a selfish act, and that it's not one that is acceptable, especially as either a caregiver or a professional helping others, that self-care is not important. And in fact, that it's one of the most important. It's significant to emotional, mental, and physical well-being. They found that those who are not providing regular self-care or engaging in self-care do, in fact, have a higher risk at burnout and compassion fatigue. And then the very folks that they want to devote their time serving are the ones that they're actually harming, because they're not in a good place themselves. So self-care is vital. It's important. When you don't take care of yourself properly, your mental, physical, and emotional health can deteriorate. And it is not treating yourself self-pity or selfish. And I want to take a moment to describe what I mean by that, because often in the workshops that I've facilitated, folks will say, my self-care is eating, chocolate cake, or my self-care is drinking alcohol. That's not self-care. That's a form of indulgence, and it doesn't have the regular practice of bringing improvement to health and well-being. So I share with folks that if you have a alcoholic beverage once in a while, or you have chocolate cake once in a while, that's an indulgence, and that's fine. There's nobody judging you for that. But if you're dependent on that to have regular emotional and physical well-being, it will not serve that purpose. So when you have a tough time at work with either your leadership or with the patient caseload that you have, the chocolate cake won't necessarily support you in being able to handle that kind of stress. So yes, people turn to food for coping, but that's not necessarily what self-care is. That's just a different way that people find indulgence and comfort, but it isn't self-care. And we'll break down more details of how you can engage in self-care that has more impact on your emotional health. So you can move forward with that. So is this where, Dr. Gitika, you talk about the...
You can move forward with it. Yeah, you can talk about it. Yeah.
So the tripod, the main areas that we support for self-care and our physical health is the resting, getting enough sleep. It's often not emphasized in terms of practice when we talk about sleep. We talk about it a lot. I should get more sleep. I really need more sleep, but we don't take enough practice in making that happen. And sleep is one of the most, and Dr. Gitika will talk about how it affects you physically and how it can cause more stress when you're not getting enough sleep. But it's very important to balance getting enough sleep in your life on a regular basis. If you had one good night of sleep, that doesn't make up for the rest of the month. You need it on a regular basis. And then eating nutritious food. I had shared that example because it's used a lot, especially in the United States where I practice. Food is used as a coping mechanism. And coping with food and food that's not nutritious can actually cause more symptoms of stress. So it's important to balance what you're eating and take more in mindful approaches to eating nutritious food. And then physical activity and movement are very important. Sometimes people skip exercise, they skip movement in order to get the work done. And it's actually causing not only weight gain or physical illness, but not having regular activity can cause an effect on your mental health as well. So these areas are very important. It's not just cliche, and it's not something to just say because we all know, we hear it all the time. You got to eat right, you got to sleep enough, and you've got to move enough. It's actually impacting your ability to do your job when you are not able to balance this and put it into your lifestyle. So you don't have to start big by going to a gym every day at 6 a.m. in the morning, but you should start with some steps to start balancing these areas. You can go to the next slide, please.
Yeah, and just one thing that it's a bit like just telling you what's coming in the next session. In the next session, we will also talk a little bit about the neurobiology of stress and where this tripod of physical wellness is really helpful in also addressing stress at the neurobiological level. So we'll definitely talk more about this. So definitely keep this slide handy. Sorry, this is my slide and I was having problems with my keyboard. So one other form of self-care that I often invite folks to consider is creating a small space between the stress and yourself. A lot of times we are so close to the stress and we are reacting to it almost like automatically. And the importance of creating some space between the stress and yourself and noticing your reactions and doing something different. And self-compassion, gratitude practices end up being one thing that you can insert between yourself and a stress. A lot of times we take it very personally when we find something difficult, or if we also get very frustrated. Let's say something you're working with a patient, and no matter what you do, it's very frustrating because the patient's not listening. After some time, we start getting frustrated even with ourselves. Why am I constantly making appointments with this person? Why am I constantly doing this, that, and the other? Sometimes our work can get so stressful and we can start also getting frustrated with ourselves in the process. So actually inserting some kind of self-compassion, so what they call that karuna bhav in in Sanskrit and Hindi, and the idea of compassion is imagining sometimes the people in your life who've been really, really kind and compassionate towards you, you adopting a similar stance towards yourself by actually acknowledging your suffering, acknowledging this thing that I do is hard. We get so used to doing our work, right? We get so used to, yeah, I see these so many patients every day. I have 10 minutes and then I eat for just 10 minutes and then I run again. We get so used to our lives. We don't realize how much we are suffering. So part of adopting that sense of karuna towards yourself is acknowledging this is hard work, and then acknowledging the universality of suffering, recognizing, oh, this suffering is helping me realize I am not alone. I'm not the only doctor in the whole world. That's true. But now the way I'm suffering, I'm also recognizing I now can connect to others who experience what I experience. So I know sometimes we end up saying, why am I complaining? Everybody goes through this. It's not that. That's not karuna. Karuna is this is hard. What you're going through is also hard. And now we are connected because we have this common experience. And like Ansi will be talking more about peer support. The whole idea is exactly that. Let your suffering help you recognize that you're connected to other people, and how do we connect with each other so that we can help each other suffer less. And then also affirm your right to reduce your suffering. You deserve to suffer less. So be your own friend. Ask yourself, how can I, the way you would ask a friend, what can I do to help you feel better? Ask yourself, what can I do for myself to help myself feel better? Somewhere there's also acknowledging your blessings, acknowledging what you do have in your life, because sometimes the stress can also force you to focus only on the negative. And we as a human species, we have evolved, our brain has evolved to focus on the negative. It was necessary to focus on danger. If we did not focus on danger, we did not focus on the lion who could kill us, we would have been eaten up a long time ago. We need to focus on danger to protect ourselves. But as a result, the brain is always tuned to danger. It's not always attuned to happiness. So we have to work hard to capture that happiness. We have that happiness within us, but it's hard to capture because every time we relax, there is a fear that I'm relaxed, there's some work that I'm missing. Sometimes we get so used to the stress, the idea of relaxing feels stressful. It just feels like I'm just going to lose out on work. So you have to work harder to acknowledge the things that are going right. Acknowledge your blessings. You know, I know a lot of times the joke is, you know, whatever you say aapki kripa hai. You know, like the joke of it's the Lord's grace, and actually feel it. It's the Lord's grace that there are blessings. Acknowledge what takes care of you. It could be the larger universe, it could be God, it could be also the people in your life, and maybe circumstances in your life. Gratitude research continues to show that the way to really benefit from your gratitude practice is recognize the people you are grateful for. So very concrete, the people in your life you're grateful for, and the events in your life that you're grateful for. So recognize not only how those events happened, because everything is so complex. You know, things don't just happen because you did it. Things happen because a set of circumstances came together to make them happen. So acknowledging who and acknowledging events, the circumstances that made those events happen, acknowledging the feelings that are created when those good events happen. In general, compassion and gratitude is associated with a sense of well-being. And when you experience well-being, that itself is a buffer against stress. And a buffer is really just this, that when we walk on concrete roads, the concrete road does not change when we wear shoes, but our shoes protect us from the damage of those concrete roads. So whatever you are doing to take care of your well-being, compassion, gratitude, all those well-being practices are like shoes that you're wearing on the road. They're protecting you from the damage of stress. Just like compassion, satisfaction is protecting you from the damage of burnout. So inviting folks to consider as part of their self-care practice, self-compassion and gratitude practice as well. Yeah. Shall I go over to the next slide now?
Sure.
Right.
So we wanted to take a moment to practice an activity right now for those who are comfortable. And Dr. Gitika and I will share our personal response to this activity, and hoping that some of you will join us. And for those who are watching at home, you can do this at home. It's very easy, very simple technique. And when you practice this on a regular basis, it really helps you keep your cup of compassion full and not depleted, as you feel good about where you are, even with the pressures that are happening at work. So one activity that I engage in daily is I look for the good. As Dr. Gitika explained, we are wired to look for danger, negativity, and look for the bad, because we needed that to survive at one time. But now we have to rewire our brains a little bit to protect us from stress. And that is by lighting up the centers of the brain that are pleasure and joy. And that comes from looking at the good. And so we have to manually do this if it's not happening automatically for us. Some of us are born more positive than others, but some of us can work towards bringing up that positivity level. So these are things you can ask yourself daily, if for what's good in your day or for the week. So it's finding the good. What is one win that you had from this week, big or small? It does not have to be huge. Even small wins will light up those centers of your brain when you reflect on them and think about them. And then you could say out loud or in your mind, I am grateful for this, whatever that win is. So an example for me, a big win from this week is that I was able to help my child get through a big application. It was a very challenging college application, and I was able to help him get through it. I didn't think we would make the deadline, but we did. So for me, that was my win. So I am grateful for the fact that I was able to get that done under very high stress circumstances. Now, I can't guarantee the application was beautifully done. I can't guarantee that it was a perfect application. I am grateful for the fact that we were able to finish it by the deadline. So that's an example. And as I speak those words and show gratitude and feel the gratitude, I'm already feeling better in this moment. So I wanted to take an opportunity to see if anyone else would like to engage in this activity, because this practice of finding and really looking for the good and saying, I am grateful, is something we don't do naturally. And it's something that you want to try to get yourself to do in your brain. So do I have a volunteer, Dr. Dhiren?
Yes, I would really like to comment on this, because I'm doing this exercise every day during the morning walk. To make it more effective, what I do is I divide this exercise into the 4 components. And to remember those 4 components, the poet is the short form. The P stands for the people. O for the opportunity for which I am grateful. E is for the events which took place in my life. It may be yesterday, it may be all throughout my life. And the T is for the things. So what physical things I have to which I am grateful. It may be my mobile phone, it may be my car, it may be anything else, electricity, the water in the house. So the poet is the easiest way. So I start with the people to whom I'm grateful, to the opportunities which I received in my life, the events which took place, and for the things which are with me. So I do it, and I really find it positive. That's not the right way, but I feel that it really works in my case. Yeah. Anyone else would like to say if we are doing this? And yes, Vaibhav, would you like to comment on this?
Excellent thing, sir. In fact, you have summarized, and I'll start with the ball rolling by saying that I am actually thankful to people in my life. I live with my parents, and every morning when I'm rushing, my mom will just get out and press the button of the lift to ensure that I save on few seconds, and I'm really grateful for that. Opportunity, of course. I'm a young person. I'm still made director by people who trust in me, and I always thank them, despite being at this age, being heading a department which is one of the most premier institute. I'm always grateful for that. Event wise, there are a lot of things that happened. We had a JBGS publication, which is one of the niche publication last week, so I was very happy to have that publication. And the things, I ordered a book that I was really wanting to read. It's called as Art of War by Shinzu. So I think I completely had a full week last full week on poet. So it was indeed a poem. Life was poem for me last week, and I'm grateful for that.
Yeah, some people change T for M, and they call it material things.
Yeah. Yeah.
So it could be poem or poet.
Yeah.
I think
And
my feeling is, Dr. Dhiren, I will add that I think we are doing it subconsciously a lot of times. But as you said, you have put in objectivity into it. So it's nice to put in objectivity into it. But I think most of us will agree that subconsciously we are doing it a lot of times. What's your thought about it?
I think it's important. It's great that you're doing it subconsciously. I think the bringing thought into it, bringing intention into it matters because we want it to be a habit that serves you even in times of stress. Sometimes it's possible that when we're doing things subconsciously, the mind is in the habit of doing it at certain times, and it may not be doing it always at the times that you most needed to do it. So bringing that consciousness to it is to also, you're sort of deepening that pathway in the brain. You're not just doing the habitual subconscious gratitude practice, which is great that you're doing, but when you do it very consciously, you are more likely to help it occur in more circumstances. And also bringing consciousness to it, sometimes it also sets a model for other people. Like when you vocally express gratitude for something, you are also somewhere reminding other people about things to be grateful for too. So there is some consciousness to, that matters too. And Dr. Dhiren, I see your hands up.
Yeah. So basically, one of my psychiatrist friend told me that, Dhiren, if you really want to get benefit of all these things, then you have to do it every day without or making a conscious effort. Once you do it consciously for a few months, then automatically it will become your unconscious habit. But for doing it, you have to start with doing it regularly at some point. It may be while you are driving, maybe while you are walking, but you need to do it purposefully. And the second most important thing which he told me, that if you really want to prevent drowning, in that case, you need to learn swimming before you are pushed in the swimming pool. If you think that if I will be pushed and then I will learn swimming, that's not the right time. So you need to learn all these things before you are really in a big trouble.
Absolutely.
Great.
Absolutely. And the drowning example, I think, is perfect. You don't want to learn swimming when you're drowning. You want to learn swimming ideally before that. So, yeah.
Yeah, Ajit, would you like to say anything on this?
Yeah, I think it's basically probably it's in many households, it's this when you get up in the morning, it's like in that movie, I think it's Munnabai, when they say good morning Mumbai, it creates such a positive. So in our house, we greet each other the first thing in the morning, and that sort of perks up the mood. It may not be in such elaborate terms, but in a nice manner, in a soft manner maybe. And we silently pray to the Almighty for giving us another bright day or whatever. And then you just get on with the day-to-day activities and don't bother much. And one thing that happened probably good in this week was a patient who had collapsed the weekend and who was given up for gone. Slowly and surely made some progress, and that really made the week for us and for the family, so to say. So that was a very gratifying outcome this week.
That's excellent. And just to add, thank you for sharing that. And just to add, sometimes these practices on a regular basis will help us be able to bounce back when the stress is too much. So that gratitude practice and recognizing that wonderful thing that happened with the patient, when you have some patients this week that are not doing so well, you can go back to that place to ground you to serve the ones who need you this week.
Prahlad, Dr. Prahlad, I see your mic's unmuted. Did you want to say something?
Yeah. So the one poet was a very interesting thing. I think so. Everyone should practice it every day. And self-care self-compassion and gratitude are the most important thing. I think so. We all should follow. In 2011, I was there in Germany. So I was assisting Dr. Isabel Venter, and she was like, even if she wanted a scalpel, she used to tell, please, that is bitte, and then after that she used to tell danke. So the gratitude of telling please and bitte on every single act was the one thing which I learned, and I try to follow it now. So giving gratitude will definitely calm you, and also being compassionate to others will definitely increase our ability to work. It will increase our proficiency as well. So, and COVID is one thing which helped us in taking self-care. So during the COVID period, we have learned ourselves to care ourselves much more than the previous any time in my lifetime. Definitely, this COVID period has definitely helped me to take care of myself much more than any time before I did, and that in fact has improved my efficacy. Now though I was thinking that I was doing more work before, but now I'm working much more with more efficiency and more like patient satisfaction.
Mm.
That's lovely. And I think just to add to also what you were saying, and I think what you were saying made me think about the beauty sometimes of self-compassion practice, intentional self-compassion, gratitude, self-care, is also it helps us slow down, which is one of the things that COVID forced us to do. It forced us to slow down. There were things that we just could not do at the pace that we used to do before. And we have, as a human race, like the joke is we save time through email, phones, and all of that, but where is this time going? I'm not putting it in a bank and saying I saved all that time, so now on the weekend I'm going to do this for 6 hours because I saved 6 hours this week. We are not slowing down, and somewhere we need to slow down, because the rush, the constant now is also creating a constant stress reaction in the brain. We've started living our lives like we are brain surgeons, that, oh, if in the next minute I don't do this thing to the nerve, this person's going to break down. We have to stop leading our lives like that. And self-compassion, self-care, and all this intentional practice, like I think Dr. Vaibhav, that the beauty of that small example of noticing that my mother touches that lift button and saves 2 seconds. But it's so beautiful that you took the moment to notice that in the rush of saving 2 seconds, but still that you took a moment, your brain slowed down and said, hey, look at that. That's what we need to be able to do. And that's why bringing intentionality into it and not just relying on the subconscious is an attempt at the heart of it to help ourselves slow down. And you'll realize that these things don't take time. And you may have noticed, like, how long does it take to say please and thank you? But the moment you do it, you've already slowed that moment down. And that is, work-life balance. You're doing that all in that one moment. So yeah, definitely wanted to highlight that as well.
Before we move on, there is one audience question. So do we want to take that question now? That's about the debriefing. Now, is it a regular debriefing is a good thing? Should we do it with our team or with our friends? So what is your take on that? If you feel that we want to take this question in the next session, then we can take it in the next session also, because in that we are going to talk more about prevention and treatment. So if you feel it's right time, then we can discuss over here, or we will discuss it next time.
I could just quickly comment on it, and then we can expand on it more later on in the next session. But debriefing with colleagues, it makes sense when you have that like-minded situation and everyone is invested in protecting the well-being of the practitioner so that the patients get the best care. So the frequency of debriefing, it's probably helpful to make that happen based on what the demands are at the department or the demands at the workplace. So if it can be done, we have a debriefing in my team every week where we talk about at the university, we talk about the student issues, we talk about the concerns that we have, and it's a very helpful space that we have protected that 1 hour per week to discuss those things instead of being left alone to handle it on our own. So I think it is a powerful thing if it's used again as a support and as a place to brainstorm and problem solve, not to finger point or to blame.
Absolutely. And also just to add to what you were just saying, that it's important to bring a growth mindset to it, that how do we grow from here? So, like no finger pointing and also no self-blaming, like, and see self-compassion instead, like, okay, that happened. What do I do? So you're growing. How do I grow from this? And also the importance of debriefing is that there is room for people to recognize what's going on, share it with, yes, like-minded others, and also see what can you learn from this that might also need to be feedback for a larger system. Whether it is our larger team needs to consider this the way we do this sometimes. Are your experiences providing you feedback about system processes, institutional processes? So it's not necessary that you'll come up with a problem solving or a memo or something or a policy change at the end of every debrief. But the idea is to invite yourself into a space of, yes, reflection with like-minded people, be in a growth mindset, not just criticism without any positive, constructive change. And also, I think being careful about debriefing not becoming a space for simply complaining with no growth, because that also can bring morale down. So debriefing shouldn't be confused with it's a time to simply complain. It is an opportunity to, yes, reflect on what's going on. You may want to complain for a little bit, but then the growth needs to be centered, like it needs to be a goal.
Mm-hmm. Agreed. So I think we have one more part, and then we were going to open up to more questions. So we were talking about how these things that some of which we already know, it's time to really put them into practice. So we have this prescription that we're suggesting that you try, which is really reflect on these daily. And we've got some nice feedback from things that the professionals in this room do that helps them and protects them. But it's helpful to use daily questions and reflections in your mind as to how you could tackle these areas on a regular basis. As I talked about self-care and the definition, self-care happens when you're engaging in these activities on a regular basis. I like daily because daily creates habits and then makes the conscious efforts into the unconscious, and it helps us maintain our well-being almost automatically. So the reflections that will be very helpful is if you start to ask yourself every morning, afternoon, or evening, what do I do to balance my tripod of wellness today? How will I get more sleep? There's no more just, I should get some more sleep. That's a good thing to do. Now you're going to reflect and ask yourself, how may I do that today? Is there possibly something I can skip? Sometimes I spend 4 hours watching a sports match when maybe I need to cut that down and get more sleep tonight. How will I incorporate exercise and movement? Maybe I'll take a 15-minute walk around the building. Instead of using that 15 minutes to answer 10 more emails, I will physically get up and walk around my workplace building. I've done that as well. When I have a very busy day, I still get up and walk 15 minutes outside and then come back to work. And how will I make myself reach for more nutritious food. Maybe I have to do my shopping differently. Maybe there's certain things that I should not buy and bring into the house because they actually cause me to indulge in things that may not be good for me. And then another reflection question, what is one good thing that happened to me today? I think we got this great example of the poem or the poet. That's a way that you could use that on a daily basis. You can use the exercise of what is my win from this week, or what is my win from today? And then adding to that, that power and the magic sometimes of gratitude and saying, what am I grateful for today? And then actually repeating it in your mind. I am grateful for, and then filling in that blank. And it's you, it's for you, it's private. It takes a minute at the most. See, self-care doesn't have to take all day. Self-care doesn't mean you have to go to the gym for an hour or or do a marathon. Marathon can be nice for some folks, but some folks don't have time for that, nor the physical ability to run a marathon. But everyone has 30 to 60 seconds in a day that they could reflect on what they're grateful for. And then a big one, reflect on how may I be compassionate towards myself today? And this is where we have to separate from the idea that self-care is selfish. It is okay to show compassion to self. It is actually vital, and it will help protect you from burnout. And when you're protected from burnout, you're actually serving others well. So asking yourself, how may I be compassionate towards myself today, is going to help you serve others in the long run. That's the magic of this. And that's what people miss, is that taking care of self is actually promoting you to take care of others. So these are the prescription reflective questions that we invite you to use on a regular basis. And then we wanted to just open it for further questions or discussion before we have to end the presentation.
So we will take one question before we request Dr. Ajit to summarize the today's session. The first question, which is again from the audience, that do we really need to isolate ourselves from the patient? Because there are two schools of thought. The one school says that you need to connect with the patient. You need to have a compassionate care. While when I was like doing my residency, and I used to get very disturbed when something did not go well. I used to become like unhappy or sad. So at that point, my professor said that, Dhiren, you really don't need to feel patient's pain. You need to isolate yourself from someone else's pain. Otherwise, you can't perform well. So what is the current strategy? Do we really need to connect ourselves or feel their pain, or we need to isolate ourselves?
That's a great question. So I'll start, and then I would love Dr. Gitika to jump in as well. So you don't have to take on someone else's pain in order to show compassion. What it helps is to understand their perspective, to validate how they feel, and then to offer assistance. But you do not have to take on that pain, because that doesn't serve you, nor does it serve them. By sitting with that pain, you do no good for that patient. But by being empathetic and understanding and showing support and response, you do great things for a patient. Because many patients here in the United States, I can't speak from the Indian perspective. I know, as a person who was a patient with doctors, or those professionals that I've worked with who've gone to doctors, they did not care if the doctor had the best knowledge and the highest level of degree. They always remember how that doctor made them feel. So if the doctor made them feel like they were responsive and could understand and validate their situation, they felt a high level of connection and wanted to continue to pursue care under that doctor. So, and it wasn't because they said the doctor took my pain and was feeling sorry for me. We don't like that either. We don't want our doctors feeling sorry for us. We want our doctors to understand that we're going through something and say, I'm here for you. I will help you with this. I'll do the best that I can. And I'm sorry that you're suffering. But saying I'll take on your pain doesn't make me feel better, nor the folks who work with doctors. So that's what I wanted to say I've experienced.
Yeah, and a lot of times, since I'm witnessing people who've gone through a lot of stuff. Like I've worked with people who've experienced very profound war situations and survived that. And there is that compassion that brings up, and it is definitely an invitation to uh, enter the world of your patients as if it were your own without losing the as if quality. Like, yes, this is a line from one of my one stalwart in the field of psychology, Carl Rogers. And that's exactly what it is, that it is being ability to see the humanity of the person in front of you. And I have a prayer that I've written on my wall, and it's just this, that may I listen to help you suffer less. So I afford you the dignity of your experience, your pain. I'm not making your pain my pain, but I'm showing up as a human being who has some skills to offer you. I'll offer you my skills, but I trust your expertise in absorbing those skills. So and I think remembering sometimes that our patients have strengths and our patients have skills too. So we are combining skills in that moment. So often remembering that compassion doesn't have to mean that I fall into the well with them. It is that I'm standing outside and offering them a rope and letting them come out on their own.
Okay. Thank you, Dr. Ajit. Can you now summarize before I pass a vote of thanks? You need to unmute yourself.
All right. Okay. So at the outset, grateful to Ansi Lewis and Gitika Talwar for this wonderful session. For me personally, it's given a great insight, looking at things from a totally different perspective. We started off this topic with the definition of the burnout that we have. Right from Ansi spoke about the definition, where is decreased energy levels or exhaustion. There is a increased distance from the job, and there is decreased professional efficacy. And also the signs and symptoms, whether it is physical, emotional, or behavioral. And also we measure the Procol scale that has been accepted worldwide. And it's basically for the individual rather than for the team, so to say. That's what has been made very clear. And Ansi talked about the scores that all of us undertook about the compassion satisfaction, the compassion fatigue, and so forth, and our own experiences with that. She also narrated her feelings and her scores that she undertakes. So that gave us an insight into looking after ourselves. That this is a score to look after ourselves, and ultimately the way to probably preventing burnout is to look after yourself first. And that's been the discussion. The good thing about this was, rather than a didactic lecture, it was more of interactive, and we were going back and forth between Ansi Lewis and Gitika. Gitika talked about the vicarious trauma or the secondary trauma that one experiences, and the strategies that people do undertake, whether it is running, whether it is exercising, whether it is maybe even prayers that she talked about, and about the self-care that Ansi talked about, the tripod of well-being, about the rest, sleep, and eat. Eat means nutritious food and not binge eating. So rest, sleep, that is rest and sleep, and eat and move. That's what she made out. So Gitika then talked about the self and gratitude, about self-care, about Karuna Bhav that she talked about, creating a space between the stress and yourself, and acknowledging the suffering of the patients or the people that you're dealing with, and at the same time not interning the other patients, other person's problems, but at the same time being human. And she ended up with a beautiful quote, "May I listen to you to make you suffer less." And I think that is what this is all about. It's all about support and understanding. This has been made amply clear by both the speakers this evening. And of course, Dr. Dhiren came up with his own poem. That also, I think, is a very good mnemonic for us to keep in mind. I think we got a good insight into all these aspects of burnout, and I'm looking forward to the next week, although I may be a little in and out in that session. Thank you very much.
So thank you everyone for joining us, and thank you audience for being with us. And I'm sure that we will meet next week, same time at 9 p.m. and we will discuss about the prevention and the treatment of burnout. And I'm sure, and I wish everyone to have a safe weekend ahead and the safe week next time, so that we remain away from burnout, because that's a big challenge for every professional. And I wish you safety and away from burnout. So with that, we end the session. Thank you. See you next week.
Thank you.
Thank you. Good night.
Thank you.
Thank you. Good night.
Yeah, so now we are off. So our recording has stopped. So we can
So
chit
can
chat.
Yeah, I have to get back to my clinic. So
Fine.
get back to my clinic really just means I change the tab now. So, but thank you so much. This was great fun. And Dr. Vaibhav, looks like you're in Bombay. Yeah, I'm from Bombay. So my parents are still in Thana. So yeah.
So whenever
Awesome.
you're in Mumbai, just
Oh, absolutely. Yes. Sounds good. All right. Bye-bye. Good night.
Okay.
Bye.
No,
Bye-bye.
Good
what
night.
days?
Bye.
Okay.
Yeah.
Bye.
So next week, Vaibhav and Ajit. Ajit, you will be like coming here and there at that point, or you are not all throughout the meeting, you are not there.
I may be busy with the faculty meeting, so that's the issue.
Okay. So
Yeah.
we will be replacing, we have Dr. Sanas Tuteja. Sunesh Tuteja.
instead of me.
Yeah, instead of Vaibhav. And we have Dr. Vivek Tirkha from AIMS New Delhi joining us for the next meeting. So Dr. Gupta and Dr. Singhi will be with us, but we will have 2 more new faculty.
Yeah, that will be great.
Yeah.
He's Trikha.
Yeah,
Vivek Trikha. I think he's arthroscopist.
No, he's
a trauma surgeon.
Trauma surgeon. Okay.
He's a good friend of mine, Vivek.
Okay. Right. Good. So we all are good friends. So
Yeah, no, I mean, I have met him quite a few times, so that's why I know him now.
Yeah.
Good friend.
And you have
we
something in
met,
common.
In person.
You have something in common along with Dr. Dhiren.
Yeah.
A bald head.
yeah, exactly. So next time,
Apart from
the
Pussy.
baldness will have a majority.
Yeah. Apart from pussy and white hair.
Yeah.
Right. Okay. Yeah.
Okay, sir. Good night. Thank you very
Good
much.
night. Good night. Thank you, everyone. Thank you.
Good night.
Good night. Yes, sweet daughter.